Health, yeah. This isn't your average health talk. We're asking those awkward questions for you. We're digging into the health, wellness, and medical news that matters to you. We're cutting through the clickbait with facts you can trust, from uncomfortable questions to breakthrough science. It's a dose of real news you can use. This is Health Yeah with Monica Robbins, your prescription for life.
Heart attacks and strokes, we know they are life and death emergencies and every second counts, but sometimes we as women wait too long. Joining me now to explain what we need to know is Shelley Webber, the executive director of our local chapter of the American Heart Association, and MetroHealth cardiologist and director of their cath lab, Dr. Aisha Siraj. Thank you both for being here. I have a ton of questions for you, one of which is we know that heart disease increases with age, but there are some very, very scary statistics out there. I've learned that 90% of people who have sudden cardiac arrest outside of a hospital do not survive, and women are less likely to get bystander CPR. That's crazy to me. So I want you both to discuss that, but first I want to talk to you, Dr. Siraj, about the fact that women have to be aware of this in addition to menopause issues. Is heart disease connected to menopause as well? Absolutely, yes.
As we're approaching menopause, the estrogen levels, the protective hormone, is going down in our system, and it increases the risk of certain risk factors such as high blood pressure, high cholesterol, LDL, which is a bad cholesterol, so you're potentially at a higher risk of having cardiovascular disease, including coronary artery disease, any kind of cardiomyopathy, congestive heart failure, as well as a higher risk of having arrhythmias secondary to hypertension. So definitely menopause contributes, and it's like a steady increase after menopause, which was not there in the premenopausal group.
So Shelley, you're going to jump in on this because I know what you're thinking right now, because women of a certain age, you know, we're still probably taking care of kids, we're taking care of grandkids, we're taking care of parents. We don't have time for ourselves. And typically the symptoms are a little odd. So what do you want women to know?
Yeah, well, we want women to be aware and to pay attention to their bodies. Like, we know ourselves the best, right? We know if something's off or not feeling right. Never ignore it, especially as we get older. You know, women experience those unique life stages like pregnancy and menopause, and you know, knowing the signs and symptoms, prioritizing your primary care visits, you know, make sure you're following up, taking your medicines, all those things. But we know sometimes that awareness, you know, can only go so far, right? So systematically, the American Heart Association has worked to ensure that physicians are educated on the protocols, and with our quality guidelines in the healthcare system, we've also revised our blood pressure guidelines that, you know, 80% of hospitals are following, to say that we need to monitor hypertension more extensively while a woman's pregnant, during the pregnancy, post, and during menopause. Like Dr. Siraj mentioned, like blood pressure is sometimes the first telltale sign something is off. And then we also work on advocacy efforts. So with the state of Ohio, we helped pass a provision for Medicaid expansion postpartum care to be a full year instead of 60 days. We know that 40% of women are never even going to the doctor postpartum, and 25% are women who actually had complications during birth. So, you know, we want there to be access to healthcare, access for people to feel like they have coverage if needed, you know, kind of eliminating those barriers. Another thing that we are working on is our Women's Venture Fund. So currently, of the average $40 billion being spent in healthcare venture capital, only 2% is on women's health. That is not fair. So we are really working to invest dollars into these companies that have some sort of advancement or solution around women's health.
You know, we're seeing so many new medications hitting the market. We're seeing new statins. We're seeing, you know, all kinds of things coming up, and research as well. Where do women fit in research?
You know, currently, less than 40% of women are included in clinical trials. And that is progress, believe it or not. I mean, years ago, when we launched Go Red for Women in 2004, it was because of the lack of research on women's health. And for many years, women weren't even included at all. So we've made progress, but we still need more. We launched Research Goes Red, which is a platform where women can get involved in research and participate in clinical trials. We will link them to trials that are happening so that we make sure that they are included in the outcomes of that science and that medical advancement that's discovered.
Does that lack of research make your job any more difficult, or is it that you're finding things with women that come to your office that you're able to start reporting on?
That's a very good question. Yes, of course, they're underrepresented. When we did all these research studies, if we go back and look at them, most of them were in the childbearing age or early menopause kind of, and they were already excluded because we never knew that statins is safe or not safe for during pregnancy or not during pregnancy, or a beta blocker or an ACE inhibitor. Now we're coming up with more studies and including more women, but they were all coming with some risk factors, even having sudden cardiac death, coronary artery disease, myocardial infarction, and different people were presenting with, different women were presenting in different subsets. Early perimenopausal women have something different versus postpartum or peripartum women. They were presenting more with something like spontaneous coronary artery dissection, coronary vasospasms, even thromboembolism. So those subset of people were never studied. And the reason was they were all excluded because they were all in the childbearing age. But now, since we are including them more, we know more and we can treat them better. At that point in time, we were doing it by case, what we were learning from each other, and then moving forward.
Is it in my head, or because we're reporting it more, or is it that younger women are getting diagnosed with heart issues more often?
Younger were always had the risk factors, but now since there's increased awareness and we're working on it, we are seeing it more. Before that, we did not have that. That's why the maternal mortality is still high, I would say, but at that time it was much more higher, and nobody looked at peripartum cardiomyopathy, for example. SCAD, for example. These are all the things that evolve over time when we looked at case-by-case things and started to include more women in research.
What's the Heart Association doing to, mitigate those risk factors?
Yeah, we have our Go Red for Men platform and our Research Goes Red, but really working in the community for sustainable health. Again, making it easy for people to be healthy, making sure they have the access to care, making sure that they have the education around their symptoms, how to be healthier. We know that lifestyle change can be overwhelming for people. We already have a lot of stress and we're busy, but it's small things. So the American Heart Association, we're a science-based organization. We are a credible voice. Everything that we put out there has been scientifically researched. So we offer that credibility. It's overwhelming to go on Google. We can all go down rabbit holes on Instagram and TikTok of health trends, right? But you could trust the American Heart Association. You can go to our website and read about the physical activity that you should be getting and the heart healthy recipes. We have a Life's Essential 8, so you can go on and take a test to basically learn your heart risk score, and it will give you customized advice and next steps.
Please do not diagnose yourself on Dr. Google or social media or ChatGPT at this point. Reliable resources is so incredibly important. And you mentioned symptoms. We as women are always, like I said, taking care of everybody else, and we ignore some symptoms. Can you two talk about those odd symptoms that women typically have? And I think it's important to mention that I guess men can have them too.
So men and women can both have the same symptoms, like chest pain, left arm pain radiating to the jaw. They've seen it on the television or some social media, but women tend to have some atypical symptoms that they can ignore. For example, just a simple acid reflux that comes on exertion. They're walking and they always have this reflux, which is getting worse. They always say this is reflux. I had a bad meal or something. It's been bothering for 3 days, and they present with a heart attack. Shoulder pain, they blame it on arthritis, but that shoulder pain is not going away. Just a simple shortness of breath. tired and fatigued, out of blue, sense of impending doom, they're feeling something. And I've seen those subset of patients coming in with a massive heart attack. So something to watch out, that women can have atypical symptoms and they need to address it or need to look out for the symptoms as well as go to the doctor and get themselves checked.
But if a woman goes to the doctor complaining of what she thinks is acid reflux or indigestion, you're not going to get seen very quickly, right?
So our aim in current day and age is to get them quicker, because now we know that they have risk factors to be seen earlier than later. We have missed a lot of women because they were presenting late when we say the damage is done. So prevention is better than cure. So we would like to see them in our offices. There's more awareness, we're doing more talks, we educate our patients, look out for patients' families. If I see a mother or a grandmother, I do tell them that if you have granddaughters, grandchildren, this is something to go back and tell them and educate them that they need to see a doctor when, this is a family history. We really don't need to know that they have a history of preeclampsia and now they are coming in their 60s and 70s and telling me, yes, I had a history of preeclampsia, but I didn't bother, it went away, so I never meant to see a doctor. They come later when they're 60 years or 70 years of age having multivessel coronary artery disease. So we always knew there was risk factors. If we would have worked on it when she was following postpartum, like how Shelley said, or at the age of 40 started screening them, we would have prevented that.
Wow, so this goes back to advocacy.
Yeah.
And explaining to women why they need to fight for themselves and be the loudest voice in the room.
Yeah, and I think it goes, well, we say awareness and education, it's both sides of the house. It's the patient, right? It's the community, but also the healthcare system. And Dr. Siraj, I'm sure, is familiar with, a lot of the work that the American Heart Association does in the healthcare setting, but that's why the research is so important, because the more research we can have, where we can present to physicians and to hospitals and to present new protocols or signs to look for, that woman going in for acid reflux may not sit in the waiting room, right? Because now that hospital is educated on maybe we need to see her faster, So I think it's the awareness, education, research, it's full circle, And then you have the advocacy and the systematic part of it too, where you're not just telling women to go to the doctor, but let's give them a year postpartum to go and have Medicaid coverage, right? We want it to be easy, because you could sit and tell people all day long, do this and do that, but if we don't have a society set up for them to be able to do those things, that's the other part. So it kind of all has to work together.
All right, let me switch gears a little bit and talk about something else that affects women, stroke. What do women need to know about stroke? And one of the things I'm finding is that a lot of people, everybody knows about weakness on one side or face drooping and that sort of thing. But I had a friend of mine who bent over to get something out of his fridge and stood up and he couldn't see out of one eye. And he was adamant that he was not having a stroke. And I kept telling him, yes, you are. And we got him to the hospital within 45 minutes and it saved his life. But a lot of people are like that, and time is brain. Can you talk about what do women need to know about stroke risk?
Yeah.
So the stroke risk, it's a bigger picture. As you mentioned about a friend, transient loss of vision, people does not acknowledge and may come back. It could be a transient ischemic attack, which can lead to a massive stroke in future, but people tend to sit at home, not worry about it. This is the time to get it evaluated. We have seen simple dizziness that can lead to a bigger stroke. Some walking difficulty can lead to a massive stroke. Yes, all people are very much aware that if you're not having the sense, or you're feeling numb, or the facial droop is happening, or you cannot have the proper speech, or you're having some kind of speech difficulty, you're having a stroke. But minor symptoms you can miss. The most things to look out is your blood pressure. You're monitoring your blood pressure. You have a family history of having strokes. Those people are more likely to affect earlier than later. Not ignoring even minor symptoms and have it checked. Go check your cholesterol. Bad cholesterol can impact you. Any risk of having higher clot burden or diseases that run in family that can have thromboembolism, those people are higher risk of having strokes as well. Not only pulmonary embolism, but also strokes. So those are the things that they need to go in order to get themselves checked and be aware of it rather than experiencing a stroke. Even if there is a minor symptoms that have subsided, they should seek help.
Do women need to be aware of more of a blood clot risk, especially in the legs that might transfer, or is that not necessarily related?
Women need to be aware that if there is a blood clot or they have a more propensity, especially when they're on contraceptives or any other kind of hormonal therapy, for example, postmenopausal, you have high blood pressure and you're on an OCP, you're adding the risk factor. So you can likely develop a DVT that can really travel through the heart to the brain. That's one substrate of causing a stroke. So they should be aware that at any point in time, if they had a DVT or a clot in their leg, they're at a high risk of having strokes also.
Yeah. And I was going to add, you know, being the executive director, I meet survivors all the time, and what always shocks me is the age of our stroke survivors, young. I mean, the ones I meet are young, and so I think one is like, don't have this image that only happens to old people, first and foremost. But two, I meet people that say, I had these symptoms, they went away, I was fine. And a week later, they had a massive stroke. So I think knowing that you could have like a mini stroke, I'm probably not using the right medical term, and think you're fine, and then it could lead to something more serious. So that to me scares me, you know, and so not that we want people being afraid, but that's why you don't ignore it. Because something, even if it goes away, like, oh, I had this weird symptom or this blurriness and this loss of vision, but you know, a few hours later it was gone, you still need to go because something else may be coming from that.
Great points. Final thoughts, Dr. Siraj.
Prevention, prevention, and prevention is better than cure. Looking out for yourself, getting screened. We are very much aware in current day and age, how do we get screened for a breast cancer, for a colon cancer? And we're doing good in those areas. It's the same for your heart. Keep advocating for your heart, get yourself screened. You're in the right age, 30, if you have a positive family history, 40, if you don't have a family history. But do consider heart is not a disease of old age. Heart disease can affect any age, and screening is the best thing to prevent any worse outcomes for future.
Yeah, and I would add, most risk factors are self-modifiable. So although you cannot outrun your genetics, you're in full control of smoking, exercise, nutrition, trying to manage your stress. So the more you can control, you know, those are things you can control to really lower your risk.
All right. Thank you so much for teaching all of us. Our heart is in our hands. I appreciate it.
Thanks for having us.
Thank you.
Thank you so much for listening to Health Yeah. Remember, you can watch the video versions of the episodes on YouTube at Monica Robbins' channel. Subscribe and follow my work and never miss an episode at author.com/Monica Robbins. Find me on X and Instagram at Monica Robbins, and I'm also on Blue Sky Social at monicarobbins.bsky.social. And you can follow me on Facebook at Monica Robbins, WKYC in parentheses. Wishing you the best of health, and stay tuned for your next dose of information.
Monica Robbins is not a medical doctor. All content presented in this program is for informational purposes only. It is not intended to be a substitute for professional medical advice and should not be relied on as health or personal advice. Always seek the guidance of your personal doctor or qualified healthcare professional with any questions regarding your health or medical condition. Thanks for listening to Health Yeah with Monica Robbins from WKYC Studios. Subscribe now so you never miss an update, and find more on everything you heard right here on WKYC.com, the WKYC app, and WKYC Plus on your smart TV.